us right now. What's the gift? That's correct.
Yeah, for sure.
Gift of time. And so now I can get them to do whatever they want. I said, guys, wouldn't it be nice when you came back as a dentist that you're coming back 110% feeling better? And by the way, when your emotions are making you feel kind of shitty, do the exercises, and I dare you to still feel as shitty as you did before. You're at least going to be shitty with perfume on. It'll smell.
Tell me something. What is your? I always like asking people this because everyone has such a different response. But from people that are successful and are very busy, I always like to know like what your morning routine looks like. Coffee.
Bulletproof coffee only. If there's no bulletproof around, I won't drink it because it's not clean. Somebody who drinks coffee beans that are not mold tested, mycotoxin tested, if they're positive, then that's why you're lethargic at 1 o'clock, 3 o'clock, 4 o'clock, and you need another boost. I've done these big events where we're, 16,000 people, and I go on stage, say at noon, and then at 4. I don't eat lunch, I don't eat dinner, and we don't eat something till 10:30 at night. It's because I have a group of people with me and we're winding down from such a crazy day. You have this in the morning, you instill the fats, and people can, we'll put something out there where people can get a hold of us, and talk about the recipe or anything like that. But you put in 1 tablespoon of grass-fed butter. I put in a tablespoon of local organic honey, which goes against it in the paleo world, in the keto world, because the honey itself to me is so gut healing and really good for the pollen count. But for me, I hated coffee until the age of 49. I tried it. I had to sweeten it up. And now I'm 52, so 3 years later. And look, these are my books to go over, except for the pain-free book, right?
Holy moly.
Yeah, but these are the books. I never had a bookshelf until stuff would sit there and it'd be like, okay, I wish I could read. I literally learned how to read at age 49.
Wow.
Because of throwing the fats in my system early in the morning completely changed physiologically my liver's response, my brain's response, my gut response.
Well, I also think that people who, I drink coffee and I have fallen into that realm where I need that pick-me-upper. And I realize a lot of it is, it's actually your adrenals or your adrenal gland. You're draining your adrenal gland. And your body is talking to you saying, hey, every time you drink that coffee, it gives you a little boost, but your body becomes accustomed to wanting that more and more and more. So what I try to tell my patients that a lot of them that come in that are overweight, I'm like, you need to focus on if you can tolerate intermittent fasting, something in that realm to help recalibrate your body, to re-energize your body. And every time I talk to someone, about this, 1 in every 3 or 4, I'll keep mentioning bulletproof coffee. They do. They say it's what keeps them going.
It's not even, look at it, it's what keeps them going could almost be an addiction. Now remember, you're talking to a guy who hated coffee. But it's not about, I get up and go, God, I need it.
Yeah.
All right, so picture this. I'm in my white robe. Sick white robe too, dude. So nice on the inside. Right, I walk downstairs, old man slippers on, but it's very cathartic. This is what we did on Bulletproof Podcast 429, if you want to go watch that. It's with Dave, and we talked about it, and I just said, look, dude, miracle. Freaking miracle. Because for you to get me to read a book was like the second coming. Like, it's that big of a miracle for me to be able to want to read a book. Like this book, these are 2 books that I read. This one, great, Story Brand. But this book, You Can Fix Your Brain. Dude, anyone with gut issues needs to read that book like right now.
What does it go over?
Tom O'Brien, Obryan, You Can Fix Your Brain.
What's it about?
It's about fixing your gut to fix your brain.
Interesting.
Micro tears, call it cheesecloth. The cheesecloth lining of the intestine that allows particles to break through once they're ready to get into the bloodstream and all this kind of stuff. Like, people look at it and go, where can I pull nutrients from? Now you're talking to a guy who knows just enough to be dangerous. So I'll let Tom do the most of the talking. But if there's a tear in the cheesecloth, then a larger particle can get through. And what's the body do? Antibodies, go get it. Woo! Police show up.
Reaction.
They do this, but then they leave collateral damage. They send the police back, collateral damage, and now you've created an autoimmune disorder.
Yeah. Chronic inflammation, for sure.
Yeah, dude, there's some amazing stuff coming out about that. And there's a guy up in San Francisco named Dr. Prasad, Prasad, an Indian doctor who worked with the Army and with NASA. He's 85 years young. And to hear this guy talk about his products, which are Micro Daily and the Micro Daily Plus, and look, everybody and their mother has approached me and Pete Agoscu and everybody about nutritional products. And the first thing I ask him is, are you MLM? Because the MLM took the wow, I love my product to, well, MLM's kind of like a way to build your business with a downline where every person that buys here, they do all this stuff. So I have no interest, and no offense against MLM. Like my kid takes Juice Plus, chewable vitamins. Well, they're an MLM. Well, I signed up because I want the product. The person above me, I send everybody to her. I'm not in the business.
Right.
But the chewable stuff for kids is great. But you do things that like the Micro Daily Plus, which has American-based CBD tied to it. Bro, this guy's come up with something that I've had like 7 or 8 women over the age of 65, 70. I've put them on it and just said, look, you just got to do this because this guy is this good. Meaning he put them on and I just send them to him. And they'll go a week later, I'm not really into it. And I said, just give it. Like, remember, they have a money back guarantee. What do you have to lose?
Yeah.
30 days into it, she comes back and goes, I don't know what's going on, but I feel so much better. Fibro, lupus,
Wow.
chronic fatigue. They're on it and they're going, my inflammatory markers, they don't speak that way, but my inflammatory markers, basically what they're telling you, are so much more level. And I believe it's no question, the micronutrients that he's put together in that order. But he also, by the addition of the CBD, really helped him with the chronic inflammatory response. So it's been amazing. Like it's one of those things for me that finally somebody came up with something clean. But I will tell you, all of this is these hacks that we tell people to do, Bulletproof, Micro Daily, all this. They're good. They're very good. But I promise you, when your body looks like this, the guy in the orange, same guy in black, when you're the guy in the orange, I don't care what supplement you're taking. I don't care what orthotic you're wearing. I don't care what, you have got to take your part and do your job to make Dr. Benji's job easier.
Right. And it's all interconnected. I mean, it's I was wondering, like, as far as like a lot of my patients come in with heel pain, okay? Plantar fasciitis, left and right, 90% of the time ends up being plantar fasciitis. And for the life of me, I can't get them to do their stretching exercises. No matter what, the runner's stretch, the towel around the forefoot to bring, the calf up and stress, stretch out the gastrocs, the soleal stretch. And the thing with Aquinas is the majority of them, their foot wants to look this way, right? This is what Aquinas is, and they don't have enough dorsiflexion. And they basically just help treat, take care of, I'll give them an injection, we'll do PRP, we'll do stem cell. I may have to do surgery on them. But the majority of the time when I actually have to operate on these patients, they're not doing their stretches. So they don't get rid of the Aquinas. And so there's still tension along the Achilles, the gastroc, and along the plantar fascia. And then 4 months later, they come back and like, hey, it's not better. And I've made them orthotics. So like, what's your advice and your tips to those types of patients?
Okay, so do you want to feel this?
Yeah.
Now you don't have plantar fasciitis, but you have enough kinesthetic awareness to be able to feel your foot on the ground. So get barefoot.
Okay.
I want you to take a walk away from your office, go down the hallway, get to some hardwood floors if you have to. I don't care or tile, I don't care. But just feel your foot strike. And now foot strike should basically, remember we're talking to a customer. Heel strike center, midfoot center, push off of all 5 toes center.
Mm-hmm.
Like you shouldn't be going out on the outer edge, pushing off the big toe, the bunion form. Say it should be center, center, center. Remember, we're not in a biomechanics class at podiatry school. Take a walk just like that, then come back with your hands fully interlaced and pull your elbows back and tell me what changed about your foot strike.
Okay.
Because it's going to be completely different.
All right.
We'll wait for you.
play some music.
You got to walk your normal pace.
Okay.
And now you interlace your hands behind your head, all the way together, like full on like Catholic interlacing, and then put it here. So a lot of people will think this is interlaced. But the minute I look at my humeral position, my hands are touching together, but if I put them all the way together, it raises my humerus up about another 10 degrees, which rotates my shoulder blade, mid back, all that. Elbows back, traps down, take a walk. It's going to be tough going through doorways. But what did it change about your foot strike?
It's a lot more stable for sure. And it's a lot more directed towards my heels.
Okay. So you just asked me, what could I give them? Well, I would look at all the treatments you did because you're going to help them, blah, blah, blah. They won't do their exercises because if I had a scab right here, and then you had to keep your hands off it to heal, but I kept going like this, and it kept hurting me. It kept hurting me. It kept hurting me. It kept hurting me. I might want to stop picking the scab. So the stretches to the lower extremity for a lower extremity injury are a complete waste of time. Because what you're actually doing is you're activating muscle tissue to become more hyper, more facilitated on an area that just needs to release or rest.
Mm-hmm.
So one of the go-tos that we would talk about is, hey, maybe put them in that position for a while. Sorry, this is authentic art. That's why it's signed on the bottom.
I have seen you do that at Bulletproof. That's right.
So when you think about it, you put the kyphotic client into that position, their mid-back starts to change, the reaction down the spine, the pelvis starts to change. Remember what we did when we stretched out the calf, and it went to gastroc, it went to femur rotation, it went to pelvis. Well, now we're going the other direction. You go to increased extension in the mid-back. The pelvis now can neutralize its tilt. The femur head can now rotate differently in a reaction. Hey, we facilitated psoas function. We have quad and hamstring working congruently, balancing out the pelvis. Now my foot strike's different. And hey, doc, I feel better.
Yeah.
Remember the step down. Because you were explaining to me, a lot of times I have to do this, PRP, stem cell, do this, stretches, blah, blah, blah. And sometimes I'll even have to do surgery. But you didn't run to surgery right away. Right. You're not the surgery happy doc. Right. It's like, if I have to do it, we'll do it, because you understand how complicated the foot is.
Right.
But it's perfectly designed with whoever you guys believe and everybody else's faith, whoever they believe is really creating the foot. My belief is it was designed perfectly. Pete Egoscue's belief, it was absolutely created perfectly from a guy who had zero medical training, so no blinders on coming in. He went, what if? Whereas my training, nowhere near as strong as yours, I would go, blinders on, here we go. It's got to be biomechanics. It's got to be this. It's got to, no. In fact, when I tape your ankle over and over again, I'm creating laxity at your ankle. I'm creating a worse ankle function later.
It's not as strong, right? Because you're using something else to support it.
That's correct.
What is it about the exercise where the patient's laying down, their legs are up on the block? Can you explain that again? How that helps?
Yep. Think about it from the standpoint of most clients would come in looking like this. The guy that I showed you in the orange shirt was extreme. He had, herniated discs, all that kind of stuff.
Yeah.
Let's say it was this girl. Can you see that?
Yeah, wow. Okay.
Let's say she has plantar fascia on one foot because she's scoliosis, so she's not balanced. Or is she scoliotic because she's become balanced? So scoliosis may have been the cure for her unbalanced frame, but it comes with its own BS tied to it.
Okay.
But here's the same girl a year later.
That's amazing.
It is amazing because you start looking at that kind of stuff and you go, hey, thank God she did the work to create that difference. But when you put her down in this position, you're allowing some of that scoliosis reaction up here to level out. Very benign leveling out. Let it change organically leveling out.
God, that's amazing, man. And that's primarily why, you know, I followed your your teaching points and the techniques, because you know a lot of it is it seems like it's very easy to do. The instructions are very straightforward and simple. And for a structure that has so many different bones, and then obviously not just the foot, the ankle, the leg, the knee, the femur, the the spine, it simplifies everything. And it's not only for the podiatry world, but it could be tied into the chiropractic world, orthopedic world, physical therapy. I mean, it's a game changer.
They instantly get it, especially chiros, because they come from a place of, if the spine's off, the world's off.
Yeah.
Neurologically speaking, they totally get it. I mean, I work with so many of them that they're just like, okay, this makes total sense. But I title a lot of the descriptions as, who's taking care of you, doc? You're chronically taking care of patients all day. Who's taking care of you? Well, I get adjusted by my friend. What are you doing?
Right.
You know what I mean? Like, it's a, looking at business models and stuff like that. We already have these relationships with stem cell companies and chiropractors and different orthopedic people who get it and say, man, I really would love to put the Egoscue stuff into my office. Well, you can. You can make the recommendation to the customer. They can go home, and once they start sending me pictures of their own posture, hey, I came from Dr. Benji's office. It's no longer your procedure from a HIPAA standpoint. It's the customer logging into my website and doing it that way.
Okay.
So now it becomes their responsibility to do it. And now it's a relationship between them and Art at Egoscue, because now it's not medical anymore. I'm literally only looking at posture.
Right.
I'll listen to your story about 5 surgeries, stem cells, PRP, all that. But it's my job to allow the stem cells to do their job in the long run.
Got it. And where all are your offices? In LA?
All over. We have like 30 plus in the US, but we have 2 in Japan, 2 in Mexico. LA, we have Santa Monica and Beverly Hills. But again, nobody's going there, right? So this has given us the opportunity to see someone just like this over Zoom, Skype, FaceTime, right out of their house.
Wow. That's awesome.
In fact, my next 3 hours are going to be with clients from 12 o'clock to 1 o'clock to 2 o'clock to 3 o'clock. So it's, and it won't take that long. To do an hour like this is really good, to talk to people, but literally the evaluation could be done in 10 minutes. And I could say, now go look at the videos that I'm going to send you on the app, the Egoscue Method app. And then they look at them and they call me back and say, I think I'm doing those right. Can you look at me? Yeah, let's get up on Skype now. This has given me how are they doing at the house?
Yeah.
That's the key, is what are you using?
Yeah, because the whole thing right now, especially, I don't think it's going to be normal ever again, but it's going to be a while until people will feel comfortable leaving their homes. And so I think to have an app set up with videos and demonstrations is key right now. I know the majority of my friends, I'm using the Nike app, other people are using the Peloton app. We have to be able to use these types of technologies to get the help we need. And so that's clutch that you're able to offer that online.
Yeah, I think it's going to be an amazing, thing that happens. Pretend it's CrossFit, right? What's going to happen to the CrossFit box people?
Okay, they have nowhere to go.
Nowhere to go. But now I know where you go. You do stuff at home, but you're still taking the body you think that CrossFit hurt is now going to get hurt by Peloton, is now going to get hurt by a SoulCycle or mirror class.
Right.
All of those are not guilty. Not guilty. It's never a CrossFit, Peloton, SoulCycle mirror class. It's never their fault that you're hurt. It's the body you took to it.
Correct. Yeah.
And you know that from just a foot alone. If the foot's here, 5 degrees, valgus at the ankle, you're going, well, every box jump is now comp. I mean,
right. Yeah, that's the majority of my injuries are posterior tibial tendon injuries. CrossFitters.
Dude,
Like,
can
good.
you imagine training this girl? Imagine getting this girl to show up.
Oh, geez.
Elite level soccer player.
Wow, that's terrible.
But somebody's going to go, she just had an ACL and she's probably going to have another one. And it must be because she's a female and her Q angle is different. Oh, okay. Quit playing in the Q angle. How about we strengthen these female athletes like we do men? And maybe they wouldn't have as many ACLs.
Sure.
And keep in mind, they do have menstrual cycles. So once a month, their ligament reaction is different. And you better keep that in mind.
Yeah, it's a very good point. Yeah.
All right.
All right, well, good talking to you, man. I'd love to link up again next week and chat more. This is very, very beneficial. And I think, I mean, my mission, we didn't talk about, I want to be able to help people globally. Ever since I got into podiatry, you know, my mom's a diabetic. She's had some issues with her feet. But I want to be able to have an impact, not only in the US, but be able to send my message and sell people on the idea that you are in control of your body, that, you know, you don't need to have all this technology and the latest and greatest, you know, inserts in your feet to be able to feel better and get your body better. And so I'm definitely inspired by you. I appreciate your time, and I'd love to talk to you some more.
Look, it's you know what we ought to do? We'll meet off screen and talk about some new stuff, but that's an easy thing to take it globally with this format, because now it just hits social media and we go to people and say, hey, if this makes sense, share it with everybody we know. Internally, I can tell you just off of this thing that we were talking about, my therapists are going to look at this and just eat this stuff up, because they all know the language that I'm talking, because they speak the same language.
Correct.
Just that I happen to love the camera, but you're stuck with this face when you talk to me, so I apologize.
Yeah, you're fine. Thanks for your time, Brian. I appreciate it, man.
Buddy, we'll catch up later.
Okay, man. See you, buddy.